Hey everyone, welcome back to Physiotechs. Today we're diving into facial palsy, a condition that affects the muscles of the face, often causing sudden weakness or paralysis. We'll explore its causes, symptoms, and how physiotherapy can help with recovery. Stay tuned for expert insights and tips to manage and improve facial function. If you are new to Physiotechs, please like, share, subscribe, and hit the bell icon for updates. Let's get started on your path to recovery and strength. Facial palsy, also known as Bell's palsy, is a condition where there is sudden weakness or paralysis of the muscles on one side of the face. It results from dysfunction or damage to the facial nerve or cranial nerve bone, which controls facial expressions. Facial palsy occurs when the facial nerve becomes inflamed, compressed, or damaged, leading to interrupted signals between the brain and the facial muscles. This can result in the inability to control facial expressions on the affected side, causing drooping or weakness. The onset is often sudden, and in some cases, people wake up with facial paralysis. Most common cause is idiopathic, Bell's palsy, often linked to viral infections like herpes simplex. Other causes include viral infections like herpes zoster, shingles, Epstein-Barr or cytomegalovirus, Lyme disease caused by a tick bite, trauma, head injuries, facial fractures, or surgical damage, tumors, growths pressing on the facial nerve, neurological disorders, stroke, multiple sclerosis, congenital. Some people are born with facial palsy. Other conditions, diabetes, high blood pressure, or autoimmune disorders. Patient history, onset of symptoms, prior viral infections, medical history, family history, or any trauma. Observation, inspect facial asymmetry, drooping, and muscle weakness. Check for eye closure and movement of the mouth on both sides. Functional tests. Ask the patient to perform tasks like smiling, raising eyebrows, closing eyes tightly, puffing out cheeks, and whistling. Evaluate muscle strength and coordination of facial movements. Sensory testing. Test for loss of sensation on the affected side. Grading muscle strength. Use the House-Brackman scale or Sunnybrook facial grading system to assess severity. Cranial nerve testing. Evaluate the function of other cranial nerves to rule out broader neurological issues. Facial exercises. Teach controlled facial movements like raising eyebrows, smiling, and blinking. Mirror therapy can help improve muscle control and symmetry by performing exercises in front of a mirror. Neuromuscular re-education. Retrain the facial muscles through specific techniques to improve coordination and muscle memory. Massage therapy. Gentle facial massage helps prevent muscle stiffness, pain, and improves circulation. Electrical stimulation. Low-level electrical stimulation can help improve nerve regeneration and muscle strength. Heat therapy. Warm compresses can relieve pain and stiffness in the facial muscles. Biofeedback. Use of real-time visual and auditory feedback to help the patient control and improve muscle movements. Eye protection. In cases where eyelid closure is impaired, lubricating eye drops or eye patches can help protect the eye from dryness and injury. Postural training. Maintaining good posture can enhance blood circulation to the facial area and promote healing. Since many cases of facial palsy are idiopathic or linked to viral infections, complete prevention may not always be possible. However, there are measures that can reduce the risk. Managing underlying health conditions, control of diabetes, hypertension, and autoimmune diseases. Protection from cold exposure. Avoid sudden exposure to cold weather, which is sometimes linked to triggering facial palsy. Vaccinations. Vaccination against certain viruses like shingles may reduce the risk. Prompt treatment of infections. Early treatment of viral or bacterial infections can help prevent complications, including facial palsy. Avoiding trauma. Use protective equipment, such as helmets during sports or high-risk activities to prevent facial injuries. Thank you for watching my video.